Good morning and welcome to the show. It is Monday. You know what that means. We have Dr. Roman Nation here in the studio to get us smart on how to have safe summer fun. Safe summer fun.
There you go.
Now, I remember we did a show a while back during spring break, and it got a little weird because, you know, we talked about the risks of spring break because young people are out there doing crazy stuff.
Yep.
But now here we've got the summertime, kids are on vacation, and some adults, too, are out there doing crazy stuff.
Yep.
Now, what do you do for fun? I know you're busy, you're a busy MD, you got a busy practice, but you do need to take a little break, and it's a summertime, you've got the kids.
Yeah.
What do you do for fun?
Well, last week we went scuba diving, and it's the class that my daughter was in to get certified. She was with a gentleman who was my age. He's in his 40s, and they went on some shallow dives, but he overstrained it and ended up having some weird side effects from a pinched nerve in his neck. But the confusion happened when he went to the emergency room. They thought that he got the bends from diving, but he was in less than 30 feet of water.
Yeah, I don't think that's Ben's territory.
It's pretty difficult to try and get it at that depth. But that was, that's one of the dangers of if you're not ready for it, the weekend warrior syndrome, which a lot of middle-aged guys try to do. They hit that. I think that's what he was doing. I want to do this, I've had some medical issues, and so I kind of go out and live life to the fullest now. So he got enrolled in the class and then kind of overdid it and then paid for it the following Monday.
I think it was Dirty Harry who said that a man's got to know his limitations, isn't that right? You can't push what you could do at 25 doesn't necessarily hold true at 45, does it?
Depends on the person.
Yeah.
So we have some people that are 45 that can do the same things they did at 25, but it's about consistency,
Right.
And when we talk about exercise plans for folks, especially like at the beginning of the year when we're heading into bikini season and all of a sudden people decide, you know what, I'm finally going to use that gym membership that I've been paying for the last 9 months, and then they go to the gym and they'll try and go from zero to running on a treadmill for 45 minutes to an hour, and you will pay for that.
Yeah, you will, and I there's a little personal testimony here, because ladies and gentlemen of the jury, I give you Exhibit A, the weekend warrior over here. My son's home from school.
Yep.
And the kid is made out of gristle. He doesn't have a spot of fat on him, works out every single day, totally ripped. And here I am. I'm like, I'm going to keep
I'm a little soft in the middle,
right,
but I can do what he can do.
But I can do what he can do because I used to be able to do it back in the day.
Yep.
So I went into the garage and I dusted off the old Weeder weights in there, and I knocked it out, Doc. You'd have been proud of me. Until the next day when I couldn't lift my arms. I was so sore. I was like, yikes,
There's a saying that JT uses at
and JT's your nutritionist
on staff. And he's been working out since he was a teenager. And he says you can't it's hard to overtrain, but it is easy to under recover. And so that's where most people end up having the biggest problems is, you can, if you're doing strenuous stuff, you can strain muscles and those kinds of things. And if you give them time to recover by listening to your body, it'll be fine. But if you try and do it and then do it again the next day and the day after that, that's where people get stress fractures or they get shoulder sprains. And once you start to weaken a tendon or a ligament and then you continue to stress it, it'll tear. And at that point you need surgery and lots of rehab and things like that.
So you got to give your body adequate time to repair itself.
Yeah.
And those repair times actually become a little longer as you get older.
They do.
Yeah, I know that for a fact because I figured, let me give myself a day break before I hit the weights again. And 2 days later, I was still pretty sore, and I was like, let me just go for a walk instead.
It's usually not the day after. It's 2 days after that's the worst. And the reason for that is as you exercise, the muscle tissue that's used overstretches, and the way muscles grow is you overstretch them. They have little micro tears in them, and then as your body tries to heal it, that's where the pain comes from. Is it's trying to knit those things back together by adding more muscle tissue to it.
And there's a certain chemistry, I guess, that goes to all of that.
You have to have the right, proteins in there, and you have to have adequate hydration. And there's some other supplements and things that you can do to help, helps the machinery in that repair process. But it's all, you have to be fairly knowledgeable about it. It's not just, go to the nutrition store and say, hey, I want to work out now.
Yeah, and don't jump back in with 2 feet. If you're an older guy like me, I'm actually a little older than you. I'm in my 50s, and here I am. And I remember the glory that was once Rome. You know, when I was, late 20s, early 30s, I was at the gym pretty much every day.
Yep.
And I was like, yeah, I can still do that, but I really can't anymore. So,
well, you could get back to it. You just have to take more time.
Yeah.
And I mean, one of the biggest things that we do in our clinic is with men as we age, our testosterone level drops naturally. And at the same time, another chemical goes up in our system that binds the testosterone that we make so your body can't use it. So it's kind of a double whammy. And so that's where you get the symptoms, not just the stuff they advertise on TV of, do you feel tired? Are you having sexual issues? And those types of things. There's a lot of other things that feed into testosterone, like drive. If you think about the mental drive you had 20-some years ago compared to...
all the energy and the drive and the ambition to get somewhere,
Yeah.
and then, wake up one day and you're a human capon. On that twisted note, we need to run to the local weather, but this is a fascinating conversation. Let's continue that.
Okay.
On the other side of your local weather, brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm here with Dr. Roman Nation, and we're talking about fitness and your health. Doc, we were talking about trying to, older guys like me, and maybe some older ladies as well. Maybe you've been off for a while, and you want to get back into it. You want to get back in shape. You want to look good in a bathing suit, or at least not totally gross.
Totally.
Like I do.
Please cover that up.
I'm trying to mitigate my grossness on the beach, and so exercise is part of it, but diet's an important component.
There's a good component to that. The part we were talking about with testosterone, for men it usually happens in their 40s. It's called andropause. Women, there's all kinds of research and stuff about menopause, which is supposed to be in their 50s. What they don't talk a whole lot about is the physiologic changes that happen for women in their 30s.
Right.
Usually in their mid to late 30s is when women's thyroid hormone stops producing as much as it used to. So that's where you get a lot of symptoms where their hair gets more dry and brittle. They usually chalk it up to getting older or stress from children and work and those kinds of things. But adding extra weight around their midsection and having to work harder and harder and harder to try and lose even smaller and smaller amounts of weight, a lot of that is thyroid medicated.
So that's really a hormonal thing.
Yeah, I mean, there are physiologic changes that happen with aging, and so a lot of the stuff that we do is geared towards that to try and, whether we do it medicinally, and ideally it's done when you do it with a combination of appropriate hormone therapies, nutrition, and exercise. So the one lady that I've been working with, she's been with us about 5-6 months now. She's down almost 80 pounds.
Holy mackerel, that's like a whole other person.
Yeah, she's she's a completely different person now.
That's amazing.
And she's sticking with it, and it's worth it because she's been staring at the other end of it for 3-4 decades, and not made much progress. But with the right education and the right tools, you can make a dramatically different you.
That's amazing stuff. My wife made me watch this thing last night. It was on TV. It was one of those competitive weight loss programs. I don't even know the name of it. And
probably Beachbody.
Yeah, something like that. I wasn't even sure if it was on Fox or not. But it was this lady that had lost 140 pounds or something, or 150 pounds over a 1-year period.
Yeah,
and
that's pretty drastic.
It is very drastic, and looked like a whole different person.
Yeah, and there's a certain number of risks to that, because if you don't do your nutrition the correct way, your body can lose weight, but it pulls it from places you don't want it to. It'll pull it from bone, and so you can go from a healthy bone density from the excess weight that you're carrying around, and if your body digests it in the process of trying to keep itself
running,
alive,
and
you'll pull it from muscle and pull it from bone, and you'll have some fat loss in the process. But where most people want to go is they want to lose their fat and get lean, and that's where the real education process for us takes place.
So, I guess in the minute we have left, if I'm a middle-aged guy or gal, and I want to get back into an exercise regimen and maybe do my diet over again, I can come to you.
You can.
Or just Google something, but I'd rather get some professional advice on, find out a baseline. Where am I with my health now, and how do I get to my goal?
There's on the exercise side of things, what we started with, the place to start is do something that's exertional for a maximum of about 15 minutes, and then see how well you do the next day. If 2 days later you feel like you're paying for it, that's your limit. If 2 days later then you're like, well, I'm fine, I can do it again, then you can try it for a little bit longer. And then you start with 3 intervals a week, and then you ideally want to have some cardiovascular training along with some strength training. You do the strength training first and then the cardiovascular training second.
And then there's the whole dietary dimension to all that as well.
Yeah, but hydration, protein, those kinds of things.
And I think that the key is just sticking with it.
Some of it's sticking with it. A lot of it is moderation, because a lot of people will hit burnout. And if you go too hard, and like where you were at, you know, and you feel like, I don't want to do this again because I hurt every time I do it, you can't keep up with that.
But I'm a manly man, and I'm going to do it anyway, no matter how much it hurts.
Yeah. So, but if you slow it down, and the guidelines we typically use, if you're going to increase your intensity or frequency, you do it by about 10% per week. So a lot of folks will try and do a 50% increase from one week to the next, and that's just way too much for most of their bodies to handle.
Well, Dr. Roman Nation, that is some sound advice, and thank you so much for getting us smart on our health, and I'm going to try and look good in that bikini again. And we'll be right back after your Mad Hatter Minute.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Today we're going to be talking about brakes. It's a great thing when your car runs right, but it means very little if you cannot stop. If you're maintaining your vehicle on a regular basis, you're rotating your tires every 6,000 miles. A good service technician, when rotating the tires, will be inspecting the brake system. They'll be looking at your brake pads, your brake calipers, your brake hoses, and your brake rotors. It's up to that technician to come back out and tell you, the customer, that you're getting close to needing a brake jobs. Brake jobs are a very simple process. A sign you can tell by yourself if you're going to need a brake job is a vibration. You get a vibration in the steering wheel, or you get a vibration back in the seat when you're applying your brake pedal. What this is your brake pads are closing in on your brake rotors, and your brake rotors are getting warped. They're warping left, they're warping right, getting high and low spots. And when you press your brakes, it creates a vibration which you feel back into your steering wheel and back in your seat. You'll know you need a brake job when you hear a high-pitched squealing noise coming when you're braking. Now that squealing noise will come when you're pressing your brakes, and sometimes you'll hear that squealing noise when you're just driving down the road. What that is on the brake pad, there's a little tab, and it's a hardened metal, and it makes contact to the rotor. When it makes contact to the rotor, it emits a high-pitched squeal. That's your car telling you you need a brake job. And when you hear that noise, get your car to a shop as soon as possible, because a simple brake job is going to turn into an expensive brake job before you know it. I'm David Lovett, and this has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247, and we'll check it for free.
Welcome back to the show, and I'm here with Dr. Aaron Shores, and we're talking about your spinal health. Doc, welcome back to the show.
Thank you.
Now, obviously, we have a spine here, or a model of a spine.
Correct.
And you've got a gizmo here attached to that. And explain to me what the purpose of this thing is and what problem this person might have, this theoretical person.
Right. Well, this is a device called a spinal cord stimulator, and basically it consists of a catheter or two, and this catheter has little metal contacts on the end of it, and we slide it inside the epidural space, the space in the back, and it puts electricity along the nerves in the back, not to shock someone, but it can block the pain transmission from the back of the legs. It has a massaging type quality, and this is something that we do in a trial phase to see if it helps for various types of pain ailments. We send the patient home with it for a week, let them try it out, and then we pull it out in the office in a week. They don't get cut on, it's just a temporary injection. If they don't like it, then it's a trial that unfortunately didn't work for them. But if they do like it, then we can talk about how we can implant it and tuck it under the skin where it can stay there indefinitely. And the patient would have a little battery like this that we tuck under the skin, and it has a wireless remote control, much like your television, very simple to use. That can be very helpful for various pain ailments.
I would imagine that someone would have to be in pretty desperate straits to want to try this. I mean, you would try a lot of other things first, wouldn't you? Or
Well, sure. Most of the time, we would would want to start with least invasive first. But unfortunately, there are many patients out there, or many people out there, that have had back surgery and it was not successful, or they have problems with their nerves in the legs, something called a neuropathy, which sometimes can be very difficult to treat, that doesn't respond well to medications. This can be an option that can work quite well for them.
So the condition someone would have, you said a neuropathy. What are some of the other things? And what is a neuropathy?
Sure,
I guess?
right.
Yeah.
Well, neuropathy is there's several different types, but in general terms, it's a dysfunction of the nerves where they no longer conduct impulses correctly. And a lot of times, folks with neuropathy develop burning in the feet. They feel like they're walking on rocks or gravel. They have sometimes some weakness and some other difficulties that can develop both in the arms and the legs. But it's very difficult to treat.
What causes that? What causes a neuropathy? Is it from an accident or an injury? Or?
Well, there's a long laundry list of potential causes, but the two most common causes in the United States are diabetes and alcohol. But there are a litany of different causes, some of which are treated. If you have a vitamin deficiency, for example, sometimes if you correct the vitamin problem, then the neuropathy symptoms will improve. But many times there's not much that can be done for it. And
oftentimes people can't help diabetes, but you can certainly help alcohol. It sounds like these are kind of behavioral-based problems.
Yes. Sometimes yes, but alcohol obviously has some addiction potential to it.
Yeah, and these are lifestyle type things. I mean,
sure, correct.
Boy, so don't drink, and I guess don't smoke too.
But yeah, it works well for these patients because many times the medications don't work.
Yeah.
And they have side effects, or they make them sleepy or dizzy, or they cause swelling and weight gain and other problems. So sometimes patients want to get off the medications, which is a common complaint that I hear. Not to mention they're expensive and they have to buy them every month.
And there's always like some sort of side effect for a lot of medications. It may make you drowsy. Who knows?
Correct. Exactly.
Yeah. So people opt for this, and although it seems rather invasive, it may relieve them of the pain they're having and help them lead a more normal life.
Yeah, it works. When it works quite well. It's certainly not as invasive as a traditional surgery. It's the trial is just a glorified injection, very similar to something called an epidural, and the procedure to put it in is just two small incisions that just tuck it under the skin. So there's not extensive rehab or anything that someone has to go through like they might with some other types of surgery for the spine.
This is an amazing device when you really think about it. I mean, because somebody sat up all night dreaming this up, I'm sure. I was like, hey, I got an idea. Instead of drugs and therapy, let's try this. And apparently it works.
Yeah, it works well for some patients.
And you have to change the batteries from time to time, I would imagine. Where does this little thing go?
You can implant it in a couple different areas, either the buttock or sometimes the love handle. The battery is rechargeable. There's a little wireless device that people use to recharge it. Usually people have to recharge it anywhere between once a week and once every 6 weeks, depending on how often they use it.
And it's a wireless recharger,
It's a wireless recharger, yes, sir.
But this is amazing stuff. I am astounded at this thing. And, geez, I don't want one, but if I had that kind of problem, I suppose that might be an option for me.
Yes, sir.
Now, nobody comes in and asks for this. They just come in and say, hey, my back hurts.
Sometimes patients do. This is this is state-of-the-art technology. Some patients are very informed and aware, have had it mentioned to them before, and a lot of times patients are not familiar with it. But we see it as our job to provide them with different options and help them provide or select an option that they feel is best for them.
Dr. Aaron Shores, thanks so much for bringing your spine in, or someone's spine in, and getting us smart on this device.
Thank you.
And we'll see you next time. We'll be right back after these messages. Welcome back. We've got Ariel, Melvin, and the boys one more time.
I saw my cousin this afternoon.